Welcome back to Daniyal Ultrasound Clinic, Dr.Muneer. We have got a young patient who is complaining of pain in the right lower quadrant of abdomen. The interesting thing is that he underwent a surgery for the appendicectomy, but that happened 3 years ago. But again, he is complaining of pain in the right lower quadrant of abdomen. Now let's see what comes out. This is the liver as usual, normal size, shape, homogeneous echo texture, showing no focal mass, normal echo pattern. This is epigastric view. This is stomach. This is pancreas, aorta, as usual, pulsating. This is IVC. This is superior mesenteric artery. This is the spine, which is casting shadow. This is the typical feature of epigastric view in transverse section. Now let's go to the right lower quadrant of abdomen. What we see here is a complex picture. Now, what is the complex picture? Here is the complex picture. Complex picture, like these are guts which are adherent, contracted in the especially in the right ileocecal area, and also there is a gut wall thickening of the cecum ileocecal area with impacted fecal matter. Along with these features, here is also another segment which is showing thick walled guts. Now, what are the reasons of gut wall thickening? How to define it? Now, normal gut wall thickness when boils are distended, it should be below 3 millimeters or 0.3 centimeters. And in colon, it should be below 4 millimeters or 0.4 centimeters. Here we have got, if we measure the gut wall thickening, it is 0.6 to 7 centimeters. So this is gut wall thickening, definitely showing hypoechogenic walls of the gut. There is no gut related mass. Another thing which is very important here, I have just seen is that here is the appendix also. However, the patient has history of appendicectomy, but I have observed वापर से पास हो रहा है थोड़ा. One thing which is really important to note is that there is again here is the appendicular lumen which is echogenic, hyperechogenic, and finger it becomes sausage shaped or finger like projection on. Here is the appendix. This is echogenic area or bull's eye pattern. You see, when I take its longitudinal section, it becomes a finger-like projection. This is here it is, but on transverse section, it gives us a bull's eye pattern. Here it is. Oh, this one. So along with the appendicitis, there is also another pathology lying underlying like gut wall thickening and adherent gut wall segments. So this could be an extended process, like the patient had appendicitis, but due to some reasons it was ignored, and patient has developed complications. So now Let us see what are the reasons of gut wall thickening. There are too many reasons, but inflammatory or neoplastic, as well as ischemic bowel disease and other causes like edema due to hypoalbuminemia or radiation enteritis or colitis may be considered initially, but with the other investigations we can come to know the exact cause. And regarding the appendicitis, the complications of appendicitis could are the extended process, can be acute uncomplicated appendicitis, suppurative appendicitis, gangrenous appendicitis, perforated appendicitis, appendicular abscesses or phlegm, and peritonitis could be generalized. There would be free intraperitoneal fluid and diffuse inflamed bowel loops or many other things. So this was a really complicated case showing two pathologies at the same time. However, there is no peritoneal fluid. Here is the appendix as well as this is the extended process like showing adherent guts and thick wall guts. That's that. Thank you very much.